And welcome back. September is Spinal Cord Injury Awareness Month. Falls, auto crashes, sports injuries, some of the leading causes of spinal cord injuries for about 17,000 Americans every year. And Dr. Kristen Noramali with the U of L Health Fraser Rehabilitation Institute Spinal Cord Medicine Program, that's a long one, joins us now to talk about it. Doctor, thank you so much for being here.
Thank you for having me. I'm glad to be here.
Yeah, it's a really important issue.
Yes.
You know, I was telling you just a minute ago, we kind of focused this week on a young man who's up for the Running for Youth Athlete of the Year, lives with a spinal cord injury. A lot of people live with those injuries. And I know that U of L Health is has one of the leading
hospitals for that.
Right, rehabilitation and everything. So what are some of the most common causes of spinal cord injuries? We mentioned a couple.
So you're right. When we think about spinal cord injury, we think about traumatic, right? So those are the sports injuries, car accidents, diving accidents, right? But there's also a whole group of spinal cord injuries that we consider like non-traumatic, right?
Okay.
Multiple sclerosis technically affects the spinal cord, right? If you have a cancer diagnosis with like metastasis or that spreads to the spine, that's technically a spinal cord injury, right? People who have arthritis and leads to pinching of the nerves in the back, that's also a type of spinal cord injury. And so it's interesting because there can be so many different things that can be affected, right, when you think about a spinal cord injury. Because literally the spinal cord is, I call it the conduit from the brain.
Right.
It is the thing that is telling the body what to do and when, and sending that signal from the brain. So it can present as, you know, respiratory dysfunction. It can present as heart rate issues. It can present as bowel, bladder issues, not just strength or what you can feel, which a lot of people think is mostly related to spinal cord injury.
So what are some of the signs and symptoms? If somebody thinks maybe they have, you know, an injury, what are they? What would they look for?
So it's like if you're someone with a lot of arthritis in your back, right? Maybe it's all of a sudden, hey, I'm feeling a little off balance when I'm walking, or hey, there is some numbness and tingling in my legs. What could that be? For my patients with that more traumatic, or like I was in a car accident, right? I no longer have my core muscles to help me breathe. So now I'm having a difficult time kind of taking a deep breath, right? I think a lot of people are scared because they hear the stories of the person who stretched the wrong way and that led to a spinal cord injury. It's very uncommon. But the thing is that there's not one way it can look. And that's why it's so important to follow with a spinal cord injury doctor. Here at the University of Louisville, there's 2 of us who are board certified in spinal cord injury. Fraser Rehab is now number 40 in the United States, number 1 in Kentucky for rehab and our spinal cord injury program. So I think that what we look for in signs and symptoms is more education, right? If you have a question, reach out to a spinal cord injury doctor. If you have a question, get in contact with us because we can help you kind of walk it out and tease out what the issues are.
Is that part of the prevention?
Yeah.
To find out?
That is part of the prevention. I mean, with the traumatic injuries, wear a helmet, right? Don't dive into a shallow pool, right? Wear your seatbelt. All of those things can help prevent or decrease the risk of a spinal cord injury. But otherwise, it's just awareness, right? Understanding your body, understanding what feels different, and understanding how to connect yourself to the right people who can help you find answers.
Awareness, the reason you're here today.
Awareness, the reason I'm here. Love to be here. Thank you for having me.
Doctor, thank you so much. We appreciate it. Well, still to come, despite everything